Nevada Interprofessional Healthy Aging Network. NIHAN is a 5-year geriatrics workforce enhancement program funded by the federal agency HRSA. NIHAN project provides interprofessional healthcare educational training for primary care providers, caregivers, and family who cares for the elderly at the School of Medicine and School of Dental Medicine in the University of Nevada, Las Vegas, and community care partners.
The Nevada healthcare system is relatively new and immature. The growth in population in Nevada has been explosive over the past few decades, and much of that growth has been in the geriatric population. It's a very popular place to retire. At the same time, the number of providers of medical care has not kept pace with the overall population, and certainly not with the geriatric population. In addition, Nevada has 2 major metro areas, but it's a very large state, and so we have many people who live in rural communities that are far from these metro areas, and even many people who are far from smaller communities where they can get primary care.
The goal of the NIHAN project is to train healthcare professionals to jointly manage the oral systemic healthcare needs of older adults, provide caregiver support, and integrate geriatrics within primary care. One of the NIHAN objectives is to establish age-friendly systems that focus on addressing what is important to the patient's health goals, identify and manage depression, delirium, dementia, maintain mobility and function, and optimize the use of medications to reduce burden and harm. The goal of the NIHAN educational program is to develop interprofessional geriatric education with the innovative use of high-fidelity mannequins and standardized patients at the Clinical Simulation Center of Las Vegas is central to the NIHAN educational program implementation.
The project ADRD, or Alzheimer's disease and related disorders, seeks to inform and educate residents of Nevada about Alzheimer's disease and other disorders of the brain that can cause cognitive decline. It is important that those doctors feel comfortable with these conditions because the population is underserved, and so we need every one of our doctors to be efficient and effective at diagnosing this. Secondly, I want healthcare students in these rural areas to be aware that they will be seeing patients with Alzheimer's disease and related disorders when they graduate, to feel comfortable knowing that and to feel comfortable in treating those patients. And then we also want patients and their families to know where they can get education and support that they need to confront these disorders.
Partnering with community organizations such as Volunteers in Medicine, the Nevada Adult Day Healthcare Center, the William B. Reary Rural Health Clinic, the Cleveland Clinic Lou Rubo Center for Brain Health will enable NIHAN to transform care delivery by integrating geriatrics into primary care.
To overcome these challenges, the NIHAN project focuses on the 4 M's: medication, mentation, mobility, and what matters. These are core elements of geriatrics care. The overarching mission of the NIHAN project is strengthening geriatrics within primary care in Nevada's aging communities by developing a strong, high-quality healthcare workforce, harnessing patient and family engagement, and improving overall health in older adults.